Welcome to Caregivers and Community Connection. Of course, I'm Sharon Kelly, and I'm your host each and every Saturday morning at 11 a.m. and Sunday morning at 8:30 right here on Comcast Cable, Channel 96. You know, I got a real exciting show this morning talking about something that we have gone through all week since Tuesday, and now we are really confused. So I thought I would bring the expert in on the Affordable Care Act. And I want to introduce her this morning. How you doing, Miss Susan Freeman?
I am great. What about you?
I'm doing great. I'm doing great. Girl, I am so confused now. And I'm a nurse. And so I thought that I would bring the expert in to talk to the community about the Affordable Care Act. So many people have asked me questions about it. It got launched this past Tuesday. And I know now your phone should be ringing off the hook.
Yes.
If not, we're going to make it ring off the hook. What about that? But just kind of introduce yourself. Tell us a little something about yourself.
Okay. I am Susan Freeman, and I am a licensed insurance agent, and I do specialize in Medicare. I've been in the insurance world about 25 years, a little over 25, I'm going to say about 25 years. So I sell the life insurance, the health, and dental insurance. And I can help you with whatever questions you have regarding your medical and Medicare needs.
Wow, that's a whole lot.
Yes.
And I'm sure today you need it. The whole Chattanooga probably calling
Yes.
you. I want to call you anyway. You're going to have to get a 1-800 number. But, you know, Susan, I mean, everybody seemed like they wanted Obamacare. We'll call it Obamacare as well as the Affordable Care Act. But they're so confused about it. They're hearing things in the newspaper. Some of them are not true.
Yes.
There are stories that start out right but end up wrong. And by the time it gets to about 100 people, it's altogether wrong. So I wanted you to come in today to help me to explain it to the community about Obamacare and in the Affordable Care Act. And a definition. Can you give us the definition of the Affordable Care Act?
Well, the Affordable Care Act went into existence, and it will start effective January the 1st, 2014. And it's actually just to help all individuals get health insurance at an affordable price.
Well, that makes sense.
Yes.
Affordable health care.
Yeah.
Wow. And so by saying that, I noticed there's some different things that's out there where your premium won't keep going up and up and up. Can you tell us about that? Because most people want to know what it costs and what you have to do in order to get it at a lower cost.
Yeah, well, there are certain criteria, of course. Let's just talk about the eligibility requirements first. Okay, the first thing about the eligibility requirements are you must be a citizen of the United States, and you can't be incarcerated unless it's pending charges. Some of the other qualifications is that they're going to make their determinations according to your gender, your household size. That's another thing. But the good thing about this is before there was no credit or cash advancements, for this insurance. So with this Affordable Care Act, it's going to help so many individuals, even our middle class now.
Now, most people, we keep hearing about it, but we don't have no definition of knowing how to get to this thing they call in the marketplace, or how to get through the maze of it. Can you tell us what to do?
I sure can. Well, you can go to healthcare.gov. That's where you're going to get started. Or you can also, if you're needing help, you can call the navigators. They have navigators 24 hours a day to assist you with that. And that's going to be 1-800-318-2596. And you're just going to answer a series of questions. That's going to be the first thing. Once you go through that process, there are going to be questions like your name, of course, your social security number. And this is protected information, so you don't have to worry about them, giving it out to other companies and everything.
So it won't be a whole lot of other insurance companies sticking something in your mail once you
That's
call
correct.
the
That's right,
marketplace.
Sharon.
Okay,
That's right.
great.
Right.
Great.
And you're going to need your income information because they will need that. That's to determine, if you're going to qualify for any credit advances or any cost sharings.
Wow. Now we know. Because some people are going to be have a certain amount to pay than other people, correct?
That's exactly
if they
right.
don't have insurance. So they will go by your income.
Well, that's going to be one of the qualifications is the, your income. That's to see if you qualify for any premium tax credits or any cost sharing. It's going to be available for anyone. It's just some may pay a little more than the others.
One of the things that you brought to my attention is if your company offers insurance, but you have chose to not do the insurance part in your company, maybe because you were on your spouse's insurance, or maybe you was low income and was in a teen care program and did not want to participate in your company program. What will happen in the marketplace if you didn't ever try to get insurance from your company? Would anything change?
Well, how that works as well is if your company offers you insurance, they're going to go by the amount of the premium amount that the company costs and how much you make with the company. That's going to be a big deciding factor as well. You can still apply for coverage on the marketplace even though your company offers that insurance, but the only thing is you may not or you won't qualify for the premium tax credit. So you'll pay the full amount of that coverage.
Like, for example, I know with my company, I pay like $150 a month per employee, and they pay about $150 because the cost of the insurance is $300 a month per individual, which is quite a bit.
Right.
And so they wouldn't qualify for a certain premium if I offer the insurance. Is what you're saying?
They wouldn't get the tax credits.
Okay.
They would have to pay the full amount of that coverage. They wouldn't get the tax credits because you are offering that coverage to them.
So many people are complaining and saying, we're not ready, we need to wait, it's not really fully understood, and that's the reason why over the years I think we've been having a soft opening on this insurance deal without people even knowing, because there's some things already in existence that's in the Affordable Care Act, isn't it?
Yes.
Such as, I think it's like for your children, if they're 28 and under, out of college, and they still get insurance.
Yes, 26 years old, they can remain on your policy up to they're 26 years old.
Okay. And some of the other things that's already in there, I think we got children, they're at a point now a child can't be uninsured. Right?
Yes.
Is it something with our kids?
Yeah, so a lot of, now it's just coverage for everyone. So it's almost like no child left behind. They want to make sure there's coverage available, not only just for working individuals, but for everyone. So that's a great thing.
And I noticed that starting January 1st, 2014, what happened to me could never happen again. And that's when you're denied insurance because of a pre-existing condition. And we got so many people that had cancer, diabetes, or stroke, and they're turned down. Some of us hadn't had any of that. We just used medication to control, such as hypertensive, which is a major problem in the African American community. So, it's going to be a blessing, I think, for more people that's hating on it. I think it's going to be great for our country.
Yeah, most definitely. Since I've been in the insurance world, I've seen so many people turn down and didn't have insurance because of certain illnesses or sicknesses. So I think especially with this where they can't deny you because of pre-existing conditions is really going to be a great thing.
Yeah, if we can have insurance on an automobile, shouldn't we have insurance on a human being?
Yes.
I guess as a nurse, in your position and loving people, we understand that.
Yes.
So what we're going to do is just kind of come back in just a few minutes, and we're going to talk a little bit more about the Affordable Care Act, known as what? Obamacare?
Yes.
Because you know what? Our president do care.
Yes, he does.
So we'll be right back with Caregivers and Community Connection.
This is Mocha. If you don't know, now you know.
Welcome back to Caregivers and Community Connection. Of course, now maybe, hopefully, you're understanding just a little bit more about Obamacare as well as the Affordable Care Act with Miss Susan Freeman. Thank you so much, Susan, for coming in this morning and explaining this, because since Tuesday, I'm sure everybody's phone has been blowing off the hook and really don't understand. On the break, you and I was discussing a few things about change and different things for people to know about in regards to the different things that we can't do anymore, like keep on increasing your premium higher and higher and higher. Can you explain something about that? Whether it's the 80-20 rule,
Yes.
you know, most all our courts said they'll pay 80 and you pay 20. You know, explain about that.
Okay, well, first of all, as Sharon was saying, you know, about how some insurances before, it's like 1 month you get a bill, it could be $150, and then if you obtain a lot of claims, they could automatically go up each month on your premium. Well, now with the new healthcare reform, they're not supposed to go up. If they try to go up even 5 or let's say 10%, they have to go through a lot of other like red tape state to make sure that's justifiable, the reason why. They can't just do that anymore. And you mentioned about the 80-20.
Yes.
Now what that is the insurance companies pay 80% and you pay the 20%. So that's also a safeguard for you as well, whereas, you know, they can't just say where you got to pay the 50%, unless now there are plans that you can select where they pay 60%, you pay 40%. They pay 70%, you pay 30%.
Wow. I mean, hopefully we understand that part of it.
Yeah.
We're so used to looking at the 80-20, you know, we'll be a little confused on that one. But I think as time goes on,
Yeah.
I think we'll get better with knowing all the rules with the Affordable Care Act. Now, it's just some other things that we can look forward to in regards to what are changes going on when it comes to Obamacare or Affordable Care Act?
Yes, there are a couple of things. First of all, let's talk about, well, this has already started, but with the preventive services. Now all of the plans must include the preventive services for you. Those are going to be things maybe like mammograms, you know, things like that, pap smears, colonoscopies, and there will not be a office visit charge for that. So that's a great thing.
You know, I've done the colonoscopy this past year because they start saying that you need one every 5 years. So man, as a nurse, you know, I used to work with a lot of doctors, urologists that do that procedure. And so when I went in, I was a little nervous, and that go lightly was rough. And I was like, wow, so it's my time now. And I knew what was going to happen in that procedure. So I was like, wow. And but you know what? I don't remember anything about it. I just remember waking up, and I think we had that medication that Michael Jackson used.
Oh my
that
goodness.
they put people to sleep with. So you know, propanol.
Yeah, propanol.
So
knock you right out.
It was, and you wake back up like you didn't had anything done. So I'm saying that so we wouldn't be afraid to do pre-existing testing.
Yes.
And but if it's going to save our lives, and you're not even going to have to pay any kind of deductible to do those type of procedures. So we encourage the community to go out and do those things. So then maybe we could stop some of the stuff that's happening to us. And I think that's what the president wanted us to do.
That's right. It's about health and wellness and preventive. You know, that's where it starts. And we talked about some of the other things. You said some of the things that's going to be changing in the healthcare reform. Now, this deals with the Medicare portion, not the market shopping. but I know our seniors are familiar with this word donut hole.
Yes.
So it's also known as the coverage gap. So with the new healthcare reform, by the year, they're hoping to phase that out by the year of 2020.
Right.
So as it stands right now, each year it decreases the amount that the Medicare beneficiary have to pay out of their pocket. So now, you know, coming up in 2014, on brand drugs, they'll get a savings of 47.5%.
That's almost 50%.
Yes, well, it's actually a little more. Their savings, well, let me rephrase that. They will get actually a savings of 53% was 52.5%.
Right.
Now on the generic is where they only get a 21% savings. So they still pay a little higher, but generics are a little less than the brand.
That's correct.
Yes, so you know, it's come a long way for over the past since 2010, where they used to pay, you know, anywhere from 100% out of their pockets. So, you know, by the year 2020, it's hoping to phase away.
I know I've had so many seniors that had to get disenrolled from the adult day service because their family members had to make a choice. Because now I got to go get medicine once I got into the donut hole, and you have to pay for all your medicine except for a small percentage once you fall into that hole. So which meant that people had to choose medication over getting a break as a caregiver. So I'm so glad that it's where it is now, because it's very helpful to our seniors, and you know, who's able to utilize Medicare Part D. And to know both of those enrollment dates or to do changes on October the 1st, it might be good and it might be bad, right? Where some people know October the 1st I got to do some stuff about my health.
Yeah.
You know, hopefully we can look at it that way.
Yeah.
But the ending Medicare Part D to change anything about your plan or to join the plan is what day?
Now the beginning. Now we have October the 1st on the Medicare portion. That's pre-open enrollment. That's the first day that we can start talking about what's changing on the Medicare plans is October the 1st. But the actual date where you'll be able to start changing will begin on October the 15th and it'll end on December the 7th.
Okay, that's good to know. But now with this new Affordable Care Act, we got a little bit longer.
Yes.
And give us those dates. Hopefully we're writing this information down. Go ahead.
Now on the Affordable Care Act, that's the new market shopping. It begins on October the 1st and it will end on March the 31st of 2014.
So we got a while on that, right?
Yes, a long while. Now, if you miss that date between there'll be certain times where they have special election periods, and that's where maybe you get married or you move, so that will qualify you, you know, where you can take another plan during the market shopping season. And let me explain to you also now how the effective dates will work with the new market shopping. If you enroll in one of the market plans between October the 1st and December the 15th, your effective date will begin on January the 1st, 2014. But if you decide to wait after December the 15th, it will begin February the 1st. And if you enroll in January, it still will begin February the 1st, but if you wait to February, it's going to be the following month, which would be March the 1st.
Wow. I'm so proud of you in those dates because you got them down, and I still say I hope people are writing it down.
Yes.
And if not, they can reach you how?
Yes. You can reach me. Again, my name is Susan Freeman. That's 423-503-7350.
And I'm sure they're going to be calling you, Susan.
Well,
I promise you. But, I mean, you know, but that's good because we're able to do something with the community and educate them and inform them on what they need to do to get the help. They don't have to wait on a voice phone call. I mean, they get a human being when they call you and talk to you about their care. I do encourage people, young people, grandchildren, children to go over and check on your seniors and make sure they get this stuff right, because I don't know if are they doing this Affordable Care Act over the phone with them, or they need a computer in order to utilize these?
Now, with the market shopping, that's not going to be for the Medicare eligible people. That's for individuals, we'll just say 1 year old up to 64. Anybody that's not on Medicare, this is with the new market shopping. but you know, you will need access to a computer because you'll need to create an account. Otherwise, if you don't, I know not everybody has a computer, so that's where the navigators will come in handy, or maybe, you know, licensed agents or something that can help them.
Oh, wow. I mean, that's good to know, because sometimes people don't know what to do.
Yes.
And the reason why I kind of invented this show was to do just what you and I are doing this morning. And hopefully people are sitting down with their coffee and their pencil and their paper. Because, I mean, you know, we're going to work through this as a community and try to help our people to get knowledge on what they need to do, because this is such an important issue.
Yes.
Healthcare, because I always say, without good health, you have nothing.
That's right.
You can be the richest person in the world, but if you are in bad health, what can you do?
Yes.
And over the last couple of weeks, right here in the city of Chattanooga, I know 2 young people that passed away because they had some health problems, but they did not have insurance, and they couldn't afford the medication that had been prescribed for them. So now they're deceased. So, you know, we don't want that to happen in our country. And I think that if we care about you having insurance on your automobile, we should worry about you having insurance on a human being. What do you think about that?
Oh, most definitely. I think that's the goal of President Obama, is to make sure. That's why this new Healthcare Affordable Care Act was created, was for all individuals to have the right for health care coverage, just because of what you said. So it's really a good thing. You know, a lot of times with change, we're afraid of change. You've heard all kind of things. Well, who's going to pay for it, this and that? So with the state assistance and different things, it's really a great thing. So I encourage everyone to at least go out there and apply, or make the call, you know, to apply for coverage.
And tell us that number again.
Okay, that number is going to be 1-800-319-2596.
And how can we get in touch with you? We want your number.
Oh, you want my number? Okay.
Yeah, we want your number.
I want to make sure you get my number. That's going to be 423-503-7350.
Now, that's for either service, whether it's Affordable Care Act or either maybe Medicare Part D that's coming up the same time. So some people have changed their age, will determine if it's time for them to apply for Medicare Part D. And if they had a birthday in this age, what for Medicare Part D, what age is it?
So once you are 65 years old, it could be Medicare Part D or what they call the Medicare Advantage plans. But if you're aging in, you know, it don't have to be just during this open enrollment time, but let's just say you're turning 65 years old, it could be in May. That's an open enrollment for you. So at that time, you would also be eligible for Medicare or either a Medicare Part D plan.
So if you had a birthday, you can automatically go in and join and be a part of Medicare Part D.
That's right, because they give them 3 months before their 65th birthday and 3 months after. So it's like they really have a 7-month window, you know, to get that Medicare or Part D.
Wow. Well, hopefully a lot of people have gotten an opportunity to hear and learn some things as they went through this maze this week of the Affordable Care Act, and, you know, and trying to close our country down financially, and just all the tactics that's been used. But at the end of the day, we'll be able to take care of all people. It doesn't matter what race, creed, or color you are. We would all get accessibility to insurance and health care. So Susan, I want to thank you for taking time out of your busy Saturday morning to come in and talk with me. And I look forward to bringing you back, because I'm sure we're going to have some questions about this Affordable Care Act and all the things that's involved in it. Thank you again.
You're welcome.